Hello everyone, and please welcome back to my channel. And I'm so glad that you are here today, that I'm going to be sharing the most critical part of my life, which is systemic sclerosis. And I'm really excited to share about it because I think that more people need to be aware about it. And I will say at the end of the video or somewhere in between what are the main symptoms that you should get checked for it or see a rheumatologist about it. So please, without any further ado, let's get into the video and learn about systemic sclerosis, also known as scleroderma. So let's just get right into it, shall we? It is systemic sclerosis. It is quite a big name, so I might just call it SSC in short, or it is also called scleroderma. Sclero means hardening and derma means skin. So when it only affects the skin and not any other internal organs, like I mentioned here, then it is called scleroderma. So that's why I don't use the term scleroderma, because not only my skin is affected but other things are also affected. So let's just get firstly what it is actually. It is an autoimmune disorder. It is an autoimmune disorder, which means that your own immune system destroys your own immune system. Basically, your own cells attack your own cells and in turn destroys it. And it is an inflammatory disorder, and your eyes will get puffy, your face will get puffy, especially in the mornings. It is fibrotic also. The cause is still unknown, and do with that what you will, I guess. It affects the connective tissue, of course. It affects the connective tissue, and here I just divided systemic sclerosis into two parts, where the skin is affected and where also internal organs are affected. So systemic sclerosis is of two types. One is limited cutaneous systemic sclerosis and the other is diffused cutaneous systemic sclerosis. Let's just first talk about the limited systemic sclerosis. Limited systemic sclerosis is also known as the CREST syndrome. The C in here stands for calcinosis. Calcinosis is nothing but calcium deposits on fingers, which is under the skin and which is also white in appearance. So there it goes. I don't know if you can see or not, but here I think I have some on the sides of my fingers. This is here. I don't know if you can see or not, but yeah, this is the calcinosis part of the syndrome. So there it goes. The R stands for Raynaud's phenomenon, which is white and blue in response to cold. When it's like the slightest cold of like 24 degrees centigrade of the air conditioner, or just it gets cold after a little bit of rain and the temperature drops 3 to 4 degrees and becomes like 26-27 degrees centigrade, and then also your fingertips, like here you can see it's red, it will become white and then it will become blue. That means that the blood oxygen level is 0 there, and it can be very, very bad if you don't treat it right away. So we will not talk much about it. It is common as a standalone disorder as well. That means that it can happen to people who does not have systemic sclerosis as well. So the E stands for esophageal dysmotility, which is related to esophagus. What it does is it becomes very difficult to swallow, and the acid reflux happens also. So when you lay down, you feel like this is too much information, but when you lay down right after having like a very small meal, the thing is you have to eat like small portions of meals. You cannot eat too much at once, and by small I mean very small portions of meals. And even then, if you do not just walk and do a little bit of exercise, I think that you will feel like everything is coming out of your mouth and upwards. So not good at all. It is a connective tissue dysfunction in the esophagus, as I mentioned before. The S in the crest stands for sclerodactyly, which is restriction of hand movement, restriction of hands and fingers, and also bending of fingers. Like, you cannot really see from this angle. My left hand is not that much affected, but my right hand is quite affected by it. But it is also hard to fold your hands. Like, I cannot fold my hand more than this. So that's my definition of a fist, by the way. Don't make fun of me, but it is what it is. And so what exactly is telangiectasia? It is nothing but appearance of red dots on cheeks and nose, which happens because of dilated small blood vessels. It happens when you go out in the sun. Even if you have like very high SPF sunscreen protection, even then your face would get like really red along the cheeks and your nose. So people might think you're blushing, but you're not. So this was the limited one, which is also known as the crest syndrome, and diffuse is all of that plus your internal organs are getting affected. Like, give a person a break. And if you ask me which kind I do I have the limited kind or the diffused kind? Of course, with my luck, I have the diffused kind. So what it actually gets affected, the cardiovascular system may get affected, the lungs might get affected, and the kidney might also get affected. So the cardiovascular system, the hypertension can happen, and coronary system can get affected as well. And for the lungs also, pulmonary hypertension can happen, and pulmonary fibrosis can happen. And the hypertension of the cardiovascular hypertension and the primary hypertension is the connective tissue dysfunction, and it gets worsened by the renal impairment, which is the kidney, of course. And the kidney can be affected in the form of glomerulonephritis or the scleroderma crisis. Severe hypertension and acute renal failure causes the damage in the kidney, and it also worsens the connective tissue dysfunction in hypertension and pulmonary hypertension. So what do I have among all of this? I do have pulmonary hypertension, just maybe pulmonary fibrosis. So what happens in pulmonary fibrosis though, lung tissue gets harder, and dry cough and shortness of breath also happens. And I do have dry cough and I do have shortness of breath, so that's why it is suspected maybe I also have lung fibrosis as well. So the main organ that is getting affected is lungs for me. I also have like 100 to 110, sometimes 120 to 130 beats per minute. So it can also indicate the cardiovascular hypertension, which I don't know. I will know once I go to the doctor in the next visit. So what are the autoantibodies that are involved in systemic sclerosis? It is ANA, anti-nuclear antibodies, which comes back positive for most patients, and it is not specific because ANA positive can also suggest SLE, lupus, and other autoimmune disorders, so it is definitely not specific, but it came back positive for me as well. Anti-centromere antibodies I did not get tested for. I think it is for limited cutaneous. They just check for the diffused one because it is the more complicated one. So anti-SCL70 antibodies, I got checked for this and it came back positive, and it was like 7 point something, and it had to be like under, it should have been like less than 1, and I had like 7.3 or something. So, and it can also indicate something severe. I hope it does not get to that, obviously. And how the diagnosis happens: clinical features, which is like ANA plus ANA profile. That's what your doctor will say to you to do, like the ANA profile, which is your doctor will tell you to do the ANA and ANA profile, and of course it is expensive. So nothing is not expensive in this disorder. So antibodies, ANA is an antibody, and also nail fold capillaroscopy, which is like they will get tissue from this region. I did not do this because doctors already knew what I had, so I did not need to do the nail fold capillary, but they just took tissue from here and they say the cells are normal or not, and the capillaries are normal or not. The main question is, how do you manage it? There is going to be a specialist multidisciplinary team working with you, and especially a rheumatologist is going to be there for all your problems. So please make sure to find a good rheumatologist. And what they will get you started on are steroids and immunosuppressants. There are no proven treatment or no standardized treatment that cures SSC for sure. So, it varies from people to people, from person to person, what actually is going to be the treatment procedure. The only freaking upside is the ongoing research that's going on. So that is the only hope, and hope of sunshine, hope of ray, that is like, it's good. So what actually helps is that you have to avoid smoking, drinking, and coffee. I love coffee, but I do not drink it anymore, and there's a little sacrifice on that. And smoking and drinking are bad for your health anyways, so why would you be doing that in the first place? Okay. Then you should do some simple stretching like this as much as you can, and that's that. Number 3, you should avoid cold for Raynaud's. And number 4 is physiotherapy, and later on occupational therapy. And what I do is, of course, I avoid smoking and drinking and coffee. I never did this too in the first place. So, and gentle stretching, I avoid cold obviously as well. and gentle physiotherapy by myself, and I do not do occupational therapy as of right now, but maybe in the future I would have to do it, so there's that. So if you watched this video, and I'm really thankful for it if you did, and if you listen to my nerdy side of the disorder, you don't need to know all of this if you have this, but I think knowledge is power, so I know about it, so I thought that you should know about it as well. And I really thank you if you watched this video, and I know that not a lot of people are going to watch this video, but I'm grateful if you did. Even if one person did, I'm really grateful to you. So thank you so much for watching, and stay happy and stay motivated, and I'll see you in the next one. Goodbye.